The Council for Medical Schemes says all laboratories should decrease the amount they charge for COVID-19 PCR tests, not just the major labs. Now, the Competition Commission announced yesterday it had reached an agreement with Ampath and Lancet to decrease the price from 850 Rand to 500. The Council for Medical Schemes had called for an investigation. To discuss, we're now joined by the Chief Executive and Registrar for the Council for Medical Schemes. That's Dr. Sipho Kabane. Doctor, thank you for being with us. So only Ampath and Lancet have agreed, but there are smaller labs, some that we don't know about. The other are so, the two are so dominant, but you're saying they should also comply.
Yes, Francis, thanks for the invite and evening to your viewers. From where we sit here, we wanted every service provider that provides these pathological services to actually reduce their prices to an affordable level.
So Pathcare has not agreed. It faces a fine, but this raises a whole lot of questions. The first thing is 500 Rand. So there are concerns that people have been robbed in daylight here. How much profit is built into 500 Rand, do you think, for the big labs working at huge volumes?
You see, Francis, that's precisely what the problem is. It's difficult for anybody currently to determine a fair price and even whether that 500 is fair, because there's no transparency into the input costs that go into these tests. And this is the kind of information that we believe would assist everybody to understand. And I think it's one of the things that at some point we all need to know. How much are the input costs and what are the markups that are being used? Are these fair or not?
Yeah, so an investigation that really got to the bottom of things might be more effective than an agreement. Is that what you're saying? Yes,
Francis. We appreciate the approach that the Competition Commission took in trying to, circumvent a very long, protracted investigation and producing results at short notice in order to allow the country to, prepare itself and be able to be covered during this fourth wave. But we believe that much more needs to be done. And as you said in your opening, we need to also look at the rapid antigen tests and ensure that these tests are actually made affordable. So there's quite still some work to be done.
Yeah. Doctor, correct me if I'm wrong. If you use public hospitals, can you not go for a test for free? Is that the situation in a public facility?
In a public facility, remember that, not all those services are free. If, for instance, you're a medical scheme member, that facility will still charge you the rates that medical scheme members are supposed to pay. And basically, you'll be charged the services on a sliding scale based on your income. So those that are indigent and are, unemployed would, for instance, not pay. They would get those services for free, but the high income earners would be charged appropriately.
Yes. So say you present yourself at Dr. Chris Hani Baragwanath Hospital. You are extremely poor, but you think you have COVID-19. You will then be eligible for a test. So we do have public facilities doing those tests. Therefore, can't they give us some insight into what it costs?
We are working very closely with a group of stakeholders, including the NHLS here. And this is part of the engagement that we're having with them so that we can understand these input costs better. Because they are also indirectly going to be affected by, this decision that was pronounced yesterday. Because if that decision says 500 rands and the public labs are still charging more than that, they will be forced to reconsider the price that they are charging for the test.
Yeah. Again, I think the issue is here that people feel ripped off. This only happened because the likes of you got involved on behalf of the big medical aids. Those without medical aids who maybe don't go to public facilities but still use private facilities, do you think they've been robbed in broad daylight?
Francis, we appreciate that there's a 41% drop in the price from 850 to 500. And we also fully appreciate that some of the people were paying for these tests out of their pocket, meaning that, and given the circumstances surrounding, this pandemic, we've had individuals that have tested 4 times. So for those exorbitant amounts, I believe that individuals, yes, were hard done by, and I believe we need to look at these prices as the agreement says, that the service providers must show they must provide reports to the Competition Commission every 3 months, so that we can precisely watch, whether there's super profit making or not.
Yeah, because even one of the big medical aids, I know they put a cap so you could only get 2 tests per year. If you were testing more frequently, you would have to pay for that. If you were concerned all along about the prices being charged, we're on our 4th wave now. Why did it take so long for this matter to be dealt with, do you think?
Francis, you'll recall that the test actually started at 1,200 rands plus, and it dropped up to 850. Our concern is when we looked at our own industry report that talks about claims that are made by the various specialists at scheme level, we picked up that whilst all the other clinical, specialist groups were making a loss during that period from 2019 to 2020, the pathological specialists actually increased their revenue from 10 billion to 11.6 billion. And to us, that started to raise the red flag. We knew that this would be related to COVID. And then when we consider the fact that almost at that time, more than 15 million tests were done, and we looked at the numbers and we thought there was something that was not right. That's why we were able to approach the Competition Commission. But if you also look at the literature of what these tests cost in other countries, in the reports by WHO, UNICEF, we also picked up that there was an unexplainable, a rise in the cost there. We expected these costs to actually drop over time because of the technology advancement, the reduction of the input costs, including those of the reagents, as well as the scale, of the number of tests. But this didn't happen. So that's why in October we were able to go to the Competition Commission, and we're actually happy that they were able to come up with a solution, even if additional work still needs to be done to provide a sustainable affordability of these tests.
All right, thank you very much, Dr. Sipho Kabane, Chief Executive and Registrar at the Council for Medical Schemes. So where we are now is that the 2 big labs have agreed to only charge 500 Rand for a PCR test. But even the Council for Medical Schemes, on behalf of the big medical aids, saying there needs to be more transparency around the pricing. Maybe 500 Rand is even too high. Is everybody going to agree to that, although they do face a fine? What about the other tests? What about rapid tests? We'll follow that situation for you.